Hi guys, so today we're going to talk about different types of abortions and how they differ from Plan B. Alright you guys, so today we're talking about different types of abortions. So there's medical abortions where you take a pill and that takes care of the pregnancy, and then there's surgical abortion. Before we start, I want to say that I don't endorse any of these activities, but you should be informed about your options and then make your own decisions as to what you want to do with your body. The abortion pill is a medication that you would get from your OBGYN or from Planned Parenthood. And this pill is a one-time pill that you take, and this would be an option for you if you're less than 7 weeks pregnant. So usually when you go in, they'll do an ultrasound and they'll confirm your date, so we'll get an idea of how far along you are by your last period. But some women don't remember their last period, or their periods aren't regular, so then the only way to know how far along you are is by doing an ultrasound. Usually this is a transvaginal ultrasound, so you can check out my video about transvaginal ultrasound so you can get an idea of what that's going to be like. Once you have your ultrasound and you're dated and there's a pregnancy confirmed inside the uterus, because sometimes pregnancies form outside the uterus, so if it's inside the uterus in the right place, that's the only time that you can get treated for the abortion with a pill. And you have to be less than 7 weeks. There's some places where they do them after 7 weeks up to 9 weeks, but once you reach this size, there's a high risk that the pill will fail, so you might end up needing a surgical procedure after taking the pill and everything doesn't come out. The risks of doing the abortion pill or a medical abortion instead of the surgery is that you might have heavy bleeding with it. You might end up needing a surgical procedure. There's a small risk of infection. The other option is to just have a surgical procedure. In some states, you can have a surgical abortion up to 20 weeks. In others, I believe it could be up to 24 weeks or less than 20 weeks. So you have to check in your own state, or when you go see your OBGYN, they should tell you what the limit is. What I would have to say about that from my experience is that the farther along you are, the more risk there is to the procedure and the more traumatic the experience is. So you definitely want to decide what you're going to do early on in the pregnancy. Surgical procedures, the way it's done is they take you to the OR, they put you in a certain position where they do a procedure. It takes like, I don't know, maybe 10-15 minutes to do, but you're under general anesthesia, so you're completely asleep. The risks of doing this is risk, of course, always infection and bleeding with any surgery, a risk of injury like uterine perforation where your uterus can be punctured, and that can cause a lot of bleeding. Or you might need other different types of surgery, so your doctor should tell you what the risks of the procedure are before you start, and then you have to be okay with those. There's also a risk of ongoing pregnancy, or that they don't get everything out at the first attempt, so you might need a repeat surgery. It's very unlikely, but that can happen. So depending how far along you are, if you're very far along, your procedure might be a 2-day procedure where they put in a dilator the first day, and then the second day they do the procedure so that your cervix doesn't get torn or lacerated. So with your doctor, you can decide what's best for you. So those are the two different types of abortions, the medical abortion and the surgical abortion. The surgical abortion is also called a DNC, or some people call it a uterine scrape, and it's also known that way. And these are different from Plan B. Plan B is a pill that you take within 5 days of having intercourse. It's not an abortion pill. The way that Plan B works is that it prevents pregnancy. So if you're already pregnant, it's not going to work. It only prevents pregnancy. It's not going to cause an abortion. Plan B is available over the counter, or you can get a prescription from your doctor. It's covered by most insurances. Like I said, it's not the abortion pill. So which method is the best method? Well, that's a personal decision, and it's also based on your medical history and your risk factors. So that's a decision that you're going to make with your doctor as to what procedure is the best one for you. Usually the abortion pill is a better option if you're early on, if you're a candidate for it, if you're not allergic to it, and if you want to avoid surgery. Alright you guys, so I hope this was helpful. Subscribe to the channel, leave us any comments, email me at gynogal@gmail.com, and like us on Facebook. See you next week. It's a procedure that is done for many GYN problems. It's an Asian treatment, mostly Korean, mostly used in Korea, and the thought is that